cases in Harris County outside the city of Houston. In total, we have 15,552 cases in the city of Houston and Harris County, and 267 deaths. I want the reopening to be successful. I want the economy to be resilient, but I'm growing increasingly concerned that we may be approaching the precipice of a disaster. And if we get to that precipice of a disaster, we will not be in a position to reopen successfully. This week, the COVID-19 general hospital population in Harris County was the highest it has ever been. It was the highest on Monday, and it's gotten worse every day. We've seen increasing trends in COVID hospital and ICU populations over the past 2 weeks that are all statistically significant. I've always been concerned about reopening too quickly, us moving too fast, and we're seeing the impacts of that now. You can see the hospital population started climbing 2 weeks around after the phase 1 reopening. Now, I do want to be clear, there is plenty of ICU and hospital capacity right now in our hospital systems, and we're working very closely with our partners to monitor that. However, if the trends we're seeing right now get worse or continue to rise, we are at a very high risk of getting to the point where the threat to our hospital system is severe and we have to backtrack. We hope this trend will stop, but we have to recognize that since that initial increase after the first phase of reopening, we've only had more and more reopening phase 2, then Memorial Day, and then even more contacts. So perhaps it's unlikely to expect things to change unless we all change our behavior, take personal responsibility to keep our county and our metrics from continuing to head in a dangerous direction. We need to focus on the future right now, on taking control of this, and that's in your hands. We all want to get back to work, we want to see all our friends, we want to hug our family, go out to eat, resume our livelihoods without limitations, but we still have a long road ahead of us to end this epidemic, and we have to accept that life as usual probably will not be returning anytime soon. If we want to avoid a crisis in our county, in our community, we've got to accept that. The only way out of this crisis is for the community to work together so we can avoid further uncontrolled transmission and we can be in a position to reopen our economy sustainably and successfully. We're doing our part at the county, but we can't do it alone, and that's why today we are announcing the Harris County COVID-19 threat level system. And Mayor, I'm so glad to be here with you. Thank you so much for all your leadership and your partnership of your team with ours. The system does 3 things. First, it's clearer than what we've had so far. We owe it to our residents to have consistent and very clear data-based information to keep them healthy and safe. So this system is designed to break through the noise and help residents understand what the threat is and what action they should take. Number 2, it's a system built to last. It's a long-term solution. Harsh truth is COVID-19 is going to be with us for a while until we have a vaccine, a treatment that is widely available, and we don't have that right now. And so this will live on beyond any temporary order or executive order. And finally, this eliminates the system of lurching from one order to the next. Even as we've had additional executive orders from the state, our guidance to the public has remained constant, and I want to make sure that that guidance breaks through. So today we're announcing that we are at level 2, orange. That is significant threat in our community, and the guidance is for folks to minimize all contacts. Level 2 signifies that there's significant, not severe, that's level 1, but there is significant and uncontrolled level of COVID-19, meaning that there's ongoing transmission and that we don't have evidence that the public health measures we have in place are being able to limit that community transmission. Despite our best efforts, and Harris County, the city of Houston, have been driving to meet demand on testing and on tracing. And we're meeting that demand, but we still have uncontrolled spread. So that tells us that the level of transmission in the community is going too quickly and too uncontrolled a way for these systems to keep up. At this level, residents should minimize contact with others. They should avoid medium or large gatherings. You should not, as I've been saying, go to bars or clubs or other places where you're exposed to others in close contact or you're with large groups of people. Let me be clear. Regardless of level, folks should continue the use of social distancing, frequent hand washing, use of face coverings, and if you feel sick, trying to quarantine for 14 days, getting tested. The other levels are level 1, which is severe threat, and that is red, Level 3, which is moderate threat, that is yellow, and the recommendation is for folks to stay vigilant. And level 4, which is minimal threat, it's green, and the recommendation there is to resume normal contacts. At that point, we would be able to have a vaccine, a treatment, or to know that we can break the chain of transmission as soon as it arises. So we have a new case, we know where it came from, and we can cut the virus off right at its source. As I said, there is sufficient capacity right now at our hospitals to deal with the rise in admissions. But should that change, the county stands ready to deploy our medical shelter of last resort at NRG. I also want to note that 100% of costs associated with that shelter will be paid with FEMA or CARES Act funding. That means no draw from our county budget. As long as I'm county judge, we will fight for every federal dollar made available to protect our community from this deadly virus. I do want to thank our federal partners, FEMA Region 6 Administrator, our state partners, and our congressional delegation in all of their support throughout this emergency and helping make sure that Harris County dollars are protected at a time of great need and great economic strain. We are the third largest county in America. We are the epicenter of this COVID outbreak in Texas. We will always err on the side of action, on the side of information, and on the side of transparency. And our job is to tell people the truth. My philosophy has been to move fast and early and proactively in addressing this crisis, and that's why I'm standing here, not to scare people, but to give folks the information they need about where we are right now, because we need the community to take personal responsibility and work with us if we want to avoid a crisis. So let me stop right there. Mayor Turner will give his remarks, and then I'll return and repeat my remarks in Spanish before we hear from Dr. Shaw and Dr. Peirce. Thank you so much. Mayor Turner.
Thank you, Judge, and it's good to be with you today, and certainly want to thank you for your leadership throughout these several challenges that we face this year. And then it's good to be with State Representative Amanda Wally, the Chief Recovery Officer for Harris County, working directly with Marvin Odom, the Chief Recovery Officer for the city. Dr. Peirce, Dr. Shaw, Director Williams, and good to be with them. Let me just reiterate some of the things that Judge Hidalgo said. Going back to March, when we started down this road, and we asked people to work collectively to stymie the progression of this virus, and a number of things closed down, and we suspended service on many things. And then in April, we saw signs that we were blunting the progression of this virus. In fact, towards the end of April, we said, and you all were reporting, and people were hearing, that we had flattened the curve. Didn't mean that we had abolished the virus, but we had flattened the curve, and we were starting to see some good results. People were wearing their masks, engaged in social distancing. The number of people heading to our hospitals were going down. The number of people being in our ICU CU beds were going down, and so the numbers were looking quite favorable. And then when you looked at our numbers and compared them to other jurisdictions in the country, our numbers in Houston and Harris County were quite good, you know. And so where we are today, things started opening up as of the last week in April, first week in March, and 2 weeks pretty much after the fact. We're now seeing that the number of cases are going up, and it's being reported all over, not just within this region, but within the state, and the numbers are going up. I would say today we're reporting 210 new cases in the city of Houston, 210. And I suspect, in talking to Dr. Purse, because of the cases that are being reported, the numbers will be high probably tomorrow as well, but 210 cases. The good news is that we're not reporting any deaths, and so the number of people who have died inside the city of Houston remains at 146, but 210 new cases that are being reported, and the numbers continue to tick up. Let me just say, and one of the reasons why I wanted to be here with Judge Hidalgo and the county is to say it remains even now more important for people to mask up, put on their mask, especially when they're in a crowd or with other individuals. As we start to re-socialize, so to speak, it is just so important to mask up. More important now than even before. And people should not take things lightly or assume that the virus is under control. As Judge Hidalgo said, the virus is not under control. The community spread is not under control. And as more people get out, move about, get close to one another, we fully anticipate the numbers to go up unless people take certain steps, and that is putting on their masks, still engaging in social distancing, proper hygiene, washing their hands, the sanitizers, all of those things that work to flatten the curve back in April are going to be needed to flatten the curve again where we are now. Things are going to get even. More and more cases will come, and we will see that in the numbers. So let me just urge people to be mindful of the things that they need to do to protect themselves, to protect their seniors, people with underlying medical conditions. But in the last week or so, you know, we've reported people who have died in their 30s, for example, with no underlying medical conditions. So this is just a reminder, with so much having taken place over the last several weeks, and that there are many people who may feel as though this virus is yesterday's news. This is just a reminder that the virus is still here, and if we want a decent fall, so to speak, a lot will be determined by what we do now and through the course of the summer. So please mask up, you know. Get you something that goes with your outfit. This one doesn't go with my outfit, but this one does, you know. So just govern yourselves accordingly. Otherwise, we'll get to the position where the spread will exceed our hospital capabilities, and we will find ourselves in deep trouble. So as we say, govern yourselves accordingly. Be mindful, get the information, take full advantage of what the county has put forth with this is level number 2. Certainly don't want to get to level number 1, but whether or not we get to level number 1 will depend on what we do right now. So mask up and protect yourself. Thank you, Judge.
Thank you so much, Mayor Turner. And let me just briefly repeat my remarks in Spanish. El día de hoy estamos reportando 102 casos nuevos en el condado Harris. Menos mal no hay más muertes, pero ya entre la ciudad y el condado hemos alcanzado 15.552 casos. 267 personas han perdido sus vidas dadas al virus. quiero que la reapertura de la economía, de la comunidad, sea exitosa, pero estoy bastante preocupada que nos estamos acercando a un precipicio en este momento y que si llegamos a ese precipicio, al borde de un desastre, no vamos a poder reabrir exitosamente. Esta semana la población hospitalaria, población general de los hospitales en el condado Harris es la más alta que hemos visto. Alcanzó el nivel más alto el lunes y desde ese día simplemente ha seguido subiendo. Estamos viendo dos curvas estamos viendo una curva en particular en cuanto a las admisiones hospitalarias en el condado Harris. Y vemos que esa curva de admisiones continúa creciendo. He estado preocupada desde el principio acerca de reabrir demasiado rápidamente y vemos ahora los impactos de esa rápida reapertura. Pueden ver en la gráfica que 2 semanas después de la reapertura se empezaron a ver impactos en las admisiones hospitalarias en el condado Harris. Esperamos todos que esta curva finalmente se nivele, que deje de crecer, pero el reto es que desde esa primera fase de reapertura solamente hemos reabierto más y más dadas las órdenes del gobernador. Después hubo la fase 2, después fue el día de Memorial Day y han seguido habiendo más contactos. Entonces es bastante probable que estas curvas sigan creciendo, que las admisiones hospitalarias sigan creciendo. Para ser claros, hay suficiente espacio en este momento en los hospitales y en las unidades de cuidados intensivos. Eso lo hay, estamos en contacto con los líderes de los hospitales para observar lo que está sucediendo. Ya eso dicho, si continúan subiendo el número de admisiones de esta manera o empeora la tasa de admisiones, estamos a alto riesgo de llegar a tal posición que lleguemos a crisis en los hospitales. Entonces, eso depende de todos ustedes. Tenemos que enfocarnos en el futuro, tomar control en este momento, y eso está en las manos de todos. Todos queremos regresar al trabajo completamente, ver todos los amigos, abrazar a la familia, volver a la vida como la conocemos. Pero todavía falta mucho para llegar a ese momento. La realidad es que no hay cura ni tratamiento y no lo va a haber probablemente por un buen tiempo. Cura y tratamiento que estén disponibles a toda la comunidad. Entonces, al menos por el futuro próximo, por ahí probablemente unos buenos meses, tenemos que aceptar que no va a regresar la vida a la normalidad. Si queremos controlar esta crisis, tenemos que tomar esa responsabilidad personal por nuestras familias y poner de nuestras partes. Por eso hoy estamos anunciando el sistema de amenaza de coronavirus en el condado Harris. Este sistema hace 3 cosas. Primero, minimiza la confusión. Le debemos a todos los residentes de este condado información clara y consistente acerca de qué está sucediendo y qué deben hacer. Este sistema está diseñado para ser muy claro y fácil de entender. Segundo, este es un sistema que nos va a ayudar a largo plazo. La realidad, como hemos dicho, es que este virus va a estar con nosotros por un buen tiempo. Entonces, esto es flexible y podemos seguirlo utilizando a medida que pasen las semanas. Finalmente, este sistema minimiza la necesidad de movernos de orden en orden. Aunque el gobernador ha seguido emitiendo sus órdenes ejecutivas, nuestra información, nuestros guía al público se ha mantenido constante y queremos que esa información, que esas recomendaciones sean claras. Hoy estamos anunciando que estamos al nivel 2, es el nivel naranja sustancial, amenaza sustancial, y la recomendación que estamos dando es que se minimicen todos los contactos. El nivel 2 representa un nivel de coronavirus, de transmisión del virus que es sustancial y no controlada. Eso significa que hay transmisión del virus y que no hay evidencia que las medidas que estemos tomando a nivel de salud pública están pudiendo controlar esa transmisión. Tenemos suficientes rastreadores y suficientes pruebas, pero aún así vemos que el virus continúa a expandirse a lo largo de toda la comunidad. Entonces no estamos viendo que esos pasos estén pudiendo controlar el virus, y la transmisión es sustancial, no es severa, eso es el nivel 1, pero sí está a nivel comunitario y no es controlada. En este momento, los residentes, como hemos venido diciendo, tienen que minimizar contactos, intentar no participar en grupos medianos ni grandes, no visitar bares o antros, nada donde sea expuesto a grandes números de personas. De cualquier manera, sea cual sea el nivel, recuerden lavarse las manos, utilizar la cobertura facial, permanecer en casa 14 días si sienten que puedan tener el virus o si se sienten enfermos. Los otros 3 niveles, nivel 1, ese es el nivel de amenaza severa, y la recomendación ahí es quédese en casa. Eso es lo que hicimos ya en marzo. El nivel 2 es el que estamos ahora. Nivel 3 es amenaza moderada. Tenga cuidado, y ahí la recomendación es reanude contacto con mucho cuidado. Y el nivel 4 es el nivel verde, de amenaza mínima, y ahí puede tener contactos normales, pero para llegar allá necesitamos o vacuna o tratamiento que esté disponible totalmente a la comunidad, o que estamos pudiendo limitar la contaminación del virus. Como he dicho, hay suficiente capacidad ahora en los hospitales, y si eso cambiara, estamos listos en el condado para activar nuestro refugio médico de última oportunidad en NRG. También quiero dejar claro que un 100% de los costos asociados con ese refugio médico pueden ser pagados o van a ser pagados con dólares federales de FEMA o del CARES Act. Eso significa que no vamos a utilizar los fondos locales del condado para ese refugio médico. Por tanto tiempo como sea juez del condado, lucharemos por cada dólar del gobierno federal para asegurarnos que nuestra comunidad se pueda proteger. Finalmente, somos el tercer condado más grande en los Estados Unidos. Somos el epicentro, lastimosamente, de esta crisis en el estado de Texas. Yo siempre preferiré errar por el lado de acción, de información, transparencia. Mi trabajo es decirle a todos con claridad qué es lo que está sucediendo, y por eso estoy acá. Mi filosofía sigue siendo movernos, actuar rápidamente, decisivamente. No estoy dando esta explicación para asustar a nadie, pero sí quiero que todos tengan la información que necesitamos para no llegar a un momento de crisis. Entonces, escucharemos ahora comentarios de Umer Shah, el doctor que dirige nuestro Departamento de Salud Pública, y después el doctor Pearce, quien maneja el Departamento de la Ciudad de Houston. We will now hear from Dr. Shah and then Dr. Pearce.
Thank you, Judge. Thank you for your leadership. Thank you, Mayor, for your continued leadership as well. Representative Wally, thank you as well. And Dr. Pearce, always a pleasure to be with you. And I also want to recognize Director Williams from Houston Health Department. My name is Dr. Umer Shah, the Executive Director of Harris County Public Health and Local Health Authority for Harris County. And I want to just start by saying that we may be tired of this virus, but this virus is not tired of us. And I think that is a key message here, as the judge has outlined and the mayor has underscored, that this virus continues to be with us. This gauge allows for an easier to understand way for our community to know where we are in the coming weeks and months of this pandemic, and really what kinds of activities really are going to allow for protection of those individuals, their families, their loved ones, and ultimately our broader community. I think it's absolutely critical that as we work together, we have to remind ourselves that this pandemic is not over. We are seeing blue skies outside, it's 90 degrees outside, it's summer, and we know all sorts of activities are happening. As those activities occur, and as we resume what's happening in our communities with the state's plan to reopen, we are concerned from the public health standpoint what we are seeing in our healthcare system. Yes, we are seeing increased cases that we're identifying in the community due to testing, but as we've all said, that testing has been a challenge throughout, and getting those results back or potential delays in lab results from the community testing means that it's very difficult at times to look at just one measure. That's why we're looking at a number of different indicators that go into this gauge, including what's behind us, the healthcare system and what's happening in the hospitals, particularly in the beds and the ICU beds. And the judge has made it very clear that we have ample capacity right now in the healthcare system. That's as a system as a whole. We do know that certain hospitals are having challenges, including at Harris Health System, our LBJ Hospital and our Ben Taub Hospital. But I will say that this is a reminder to the community that we are in orange right now. That may feel like we're in green, but we're not. And we want everybody to take all the precautions they can so that they can protect themselves, again, their family members, and certainly their broader community members, and that's all of us. The other thing that I wanted to say is that as we think about where we are and how we've gotten to where we are, the judge and the mayor are absolutely right. We have done a fantastic job as a community to fight this virus, to fight this pandemic, and that's what's happened thus far, all the way up until the point over the last few weeks where reopening, what I'm calling is really layered risk, that reopening in different phases, in addition to that milestone events such as Mother's Day, Memorial Day weekend, other activities that may even seem small in some sense, graduations, etc., all of those layer upon what's happening, which means that people are out and about. We have additional transmission because of those activities, and unfortunately we were hoping that we would not be back at the podium here to say that we are seeing increases in our healthcare system, but that's exactly what we are seeing right now. So I want to urge from a public health standpoint and a health department standpoint, all of our Harris County Public Health staff who have done an incredible job, and kudos to them for all the work that they've done, along with public health partners across the region, the state, and across the country. I will say that at the end of the day, we have to rely on you, our public, to help us. We can't do this alone. We've got to do this together. And ultimately, all those precautions we're talking about really is going to help you, help us protect this community. Again, we may be tired of this virus, but this virus is not tired of us. And with that, I'm going to turn it over to Dr. Peirce.
Thank you, Dr. Shaw. I'm Dr. Peirce. I'm the local health authority for the City of Houston. I'm also the EMS medical director for the City of Houston. And I also am board chair with SETRAC. And so I want to take a little bit of a deeper dive into the data to illustrate a couple of things. And so the graph behind me, as you can see, shows a steep rise. To my right, to your left, is another view of it. It's looking at the patients that are hospitalized in regular beds versus those that are hospitalized in ICU. And what you see is that most of this increase occurs or appears to be in general beds at this point. There is an increase in the ICU beds, and this is what we have seen before, is that very commonly patients are admitted to the hospital. They're in a general ward bed, and at the end of about a week or 10 days, they either get better enough they can go home, or they become more critically ill and they wind up in the intensive care unit. So the fact that we see this increase in the general beds more so than we're seeing in the ICU beds is not in conflict. That is actually exactly what we would expect to see. The other thing I want to point out is that this increase in the cases goes back to about May 25th-ish. And so, as Dr. Shaw was saying, and I want to repeat, is that this is not one single event. There was no one single event that set this up. This is the reopening of society and people going out and engaging. Now, the good news is that I'm hearing from my colleagues in the hospital, good news or bad news, depending on how you want to look at it, but also the average age of the patients who are admitted to the hospital is getting to be younger. And this is for a variety of reasons, we believe. One is that while elder folks remain at highest risk for the most serious consequences, without nursing homes and the senior living centers and places like that, the City of Houston's Health Department, Harris County Health Department, with the city's health department, we actually engage with the Houston Fire Department, and we've been engaging with these types of facilities for some weeks now. The state has come in to assist with testing. We are also testing all of with the nursing homes. We're also testing the senior living centers, the assisted living centers. We're testing all those, coaching those folks, and it appears that that effort is being beneficial in as much as the average age of the folks that are becoming hospitalized is less so the elderly group. The bad news of that comment is that it's the younger folks that appear to be becoming hospitalized. And that is, again, consistent with the reopening of society and folks going out and behaving in ways that we really would recommend. Again, large groups, not wearing masks, not social distancing. This is difficult. We understand that. But we are also seeing the effect of that. And so now is the time for folks to change that direction. We talk about individuals with the wearing masks and the social distancing. I also want to remind employers that, from my standpoint, I look to the employers within the city of Houston, especially those with public-facing jobs. To the degree possible, I would strongly encourage you to require that your employees all wear masks. If for no other reason than to set a good example for the public. You can't make the public, you can't make your customers do it, but you can make your employees do it. It protects your employees, because if somebody comes in who's infected and they infect one employee, that employee, anyone who becomes infected, the people they are most likely to affect, again, the next person they're most likely to affect is going to be a family a family member or a coworker or a neighbor. So for the employers, if you want to protect your workforce, I would suggest that you have them wear their masks and follow all these rules. And then the final thing I want to talk about is the emergency department. So in my other role, I'm the Emergency Medical Services Medical Director. Every year during flu season, we see emergency department overcrowding. We see ambulance diversion. And I fear that that's what's going to be coming next for us here in Houston and Harris County as hospitals begin to fill up. As the judge pointed out, there is still capacity across the system. We know from SETRAC, we know that there's capacity across the system. But what that doesn't mean is that all hospitals have capacity. All hospitals don't fill up at the same rate. We're already hearing that the Harris Health hospitals, LBJ and Ben Taub in particular, are very full already. They may not be totally full, but they are very full, and there's vacancy in other hospitals. Your hospital may be one of the ones that's full, so we need to keep this in mind. The bottom line is that we don't want to get in the situation that we're in every flu season here with COVID. And as we've been hearing over and over again, it's at the point now, it's the time now where individuals, once again, can have an impact. If you take a look at this graph here, you'll see that from the far left going on, as a community, we were doing a great job. As a community, we were doing a great job. So it shows that it can work. We just need to do it again. Thank you.
Thank you, Dr. Peirce. We'll take questions now.
I'll ask my questions first, and I'll ask everybody else. What has to happen to go to like one severe? What would take place when it would be a severe level?
Basically, what we're watching these numbers very, very closely. What we are looking at in particular is the 7-day trend in admissions, and we have to make sure that those trends are statistically significant. So right now we're seeing that 7-day trend is increasing at a statistically significant level, but it's not increasing exponentially. It's increasing faster each time, but it's not really getting too much faster, for example. We have to make sure, okay, if there's an increasing trend, but there's a lot of room, then maybe we're in a better position. What the threshold we had set is that 15% of the ICU beds should at most be taken by COVID patients. At this point, we're past that. We're 15.72. We're also looking at case counts. I've tried not to focus on new cases because it depends who all gets tested, but it's a good marker to have. And so we look at the 7-day average of cases. For the 7-day average has been greater than 100 daily new COVID cases, which again is another marker. So really, we are quite concerned, but we've got to continue to look at this grouping of factors. Of course, talk to our hospitals, talk to the different levels of government, and figure out it's not, completely written down A, therefore B, and so we have to look at the confluence of factors. But what we know for a fact right now is if this worsens, it's very likely that we would have to go to level 1. And we want to proactively tell the community, look, it's not time to say everything shut down, everybody stay home, as we did back in March, but we sure are getting close to that, and we need folks to do their part.
And again, a level 1 would mean stay at home, only go out to go to the grocery store, to get medicine. That would be the only reason you should leave your house under a level 1.
Right, level 1 was the initial stay-home recommendations, which would be leave if you need to go get medicine, get food, take care of a loved one, or if you need to go get some fresh air. And that's how we were able to flatten the curve initially. Now what happened is we moved too quickly, and these contacts got out of control. And so basically we're seeing and waiting. You know, we got to see, okay, if folks do their part and they stop going to the club and the bar and the in-person graduation, will this come down? Will this flatten? And if it doesn't, and if it worsens, then it's a problem, and nobody wants that. From the beginning, you know, I want the economy to reopen successfully and sustainably. We're giving, you know, funds to individuals, to small businesses. We just committed an additional $30 million to small businesses this past Commissioner's Court. But we are not in a position to continually do that, not at the county, and I imagine that's a similar case for the city and other levels of government. So we can't be in a position where we're ping-ponging back before open and close, and that's why we are giving a shot at folks who are in orange. Do your part, take personal responsibility. We'll keep watching these indicators, and if it starts growing too quickly, too fast, we'll be back here recommending level 1.
And then level,
Yes.
sure.
I also want to make sure that we understand the mechanics. In March and April, the county judge and I, we had the ability to hit the brakes. We no longer have the ability to hit the brakes. That's controlled now totally by the state. Okay? So the state has preempted local governments from hitting the brakes. What we have is our voice and providing information and monitoring the situation. Okay, that's the ability that we have. When you look at that chart from March, going April, and see the numbers going down, the local governments have the ability to kind of drive that wagon. But as of the end of April, now into May, that ability is no longer within our hands. What we can do is monitor the situation, provide information, encourage people to wear their masks, engage in social distancing, and engage in proper hygiene.
Because of what you just said, is it more of a, hey, public citizen, it's really more in your hands and you need to kind of do the right thing, so to speak?
Look, these orders have always depended on people doing their part. We said from the very beginning, we are not a police state. We can't be out there in every street corner making sure that people are only going to the grocery store and the pharmacy. And so it is a big challenge, and the mayor is you know, absolutely right in terms of we no longer have the authority to say everything must shut down. What we're appealing to is clear communications and the personal responsibility of our community. We did all of this because people did their part. I don't think it was because anybody forced them to. It's because they knew that's what the community had to do. And that's what our community does best. We pull together, we do our part, we do our job, we move forward. And so that's what we're doing right now while we're unveiling this level, because ultimately, you know, you have the hospital leaders who are each in charge of their individual hospitals. The governor is in charge of the state. I'm responsible for this community, and I need to make sure that Harris County is safe. And I want to be crystal clear with the community as to what we need from each and every resident if we want to avoid a crisis. And I'm not going to say, look, I can't issue an order, so let it be. I wanted to give our best shot for us to be in a responsible position and hopefully at some point to be able to reopen sustainably and not in a way that just gets us to the edge of a crisis. Mayor, did you have something to add on this?
What gets us to level 3 moderate? When you see another flattening, or what would it take to get to number 3?
So what it would take to level 3, and this information is all online on Ready Harris, is it would take either a flat or a decreasing trend in the cases, in the hospital population, in the ICU population over 14 days, and it would need to be statistically significant. So it would tell us, you know, at least we're not growing, and we need to be at a point where there is enough ICU capacity. So where we have less, enough room. Of course, if you're flat but you're at a very high level, there's still concern that we need to have at least 30 days of availability of personal protective equipment for our hospitals. So those are the things we want to look at. And the idea is, from the hospital side, that we have enough space and we're not about to run out. The other thing that would take us to level 3 is we need a demonstrated reduction in transmission due to public health measures. And that's what I was getting at earlier. We look every day, how many new cases do we have, and do we have enough contact tracers? And we do. What's the demand for tests? Are there enough tests? Yes. But what we're seeing is the vast majority of the new cases, we can't tie them to one another. The vast majority of them are community spread, and we don't know where they came from. And so that tells us it's out of hand right now. The good thing is it's not severe out of hand. It's not growing so quickly that we have to shut down, but it is growing in an uncontrolled way, and despite our containment efforts, the spread is just too big to where we can sustainably really control this. So that's why if we start seeing that those public health interventions are having an impact, that's another reason that, okay, we're good, let's move to level 3, and if it gets out of hand again, then we can go back up. But we're just not there yet.
Do we know yet, are we seeing any kind of like increase from all the big public protests that we've had in the last couple of weeks? Do we know yet?
What's interesting, if you see the chart that we have right here, the lines we have is 14 days after the reopening, 14 days after phase 2, and you'll see it takes about really closer to 3 weeks for the impact to start being felt. So, we can't say anything with 100% certainty, but with a high degree of certainty, this reflects the past contacts. Of course, there were large contacts recently over the last week with these protests and with additional phases of reopening. So it's more than likely that those impacts will continue to be seen later. And that's the concern, is that this will continue to go back up. And that's why right now we're saying, please do your part, minimize all contacts to see if once we get to that, at least the impact is not as large and we don't have to recommend level 1. So these are, you can see it quite clearly, is from what happened before. The reopening, the other phase of reopening, Mother's Day, Memorial Day, whatever it was, but certainly to the extent that folks continue to have contacts, we're going to see more of an impact.
Yeah, let me go. I'm sorry, these are questions from other people. KPRC question. Is the genie out of the bottle? I'm sorry, I just lost it. Let me get on. I got one on my phone here. I'll go to channel 13 until I find that. Okay, channel 13 is asking, with the recent uptick in COVID cases, is this action being taken today too late?
I want to focus us on the hospital admissions for one. And so, because again, case is an important metric, we should watch it, but many factors go into that, including the turnaround times from the labs right now are very high. We're working on that issue. And, some of it may be the increased testing we've done in nursing homes and in the jail, this kind of thing. So let's focus on the hospital admissions. If you look at that, the calculus we have right now is they are growing. It's very concerning. They are not, we still have enough room that we don't need to sound the red alert. That is why we're standing here saying we're at orange. My pledge is I'm going to keep looking at these numbers, and I'm going to be proactive. And if we see, and what I think about every single day is I need to make sure that it's not too late by the time we go to red. And the way we make sure it's not too late, we warn people early, and we increase our capacity. So that's why we have the NRG medical shelter that's ready to go again. If we need it within 48 hours, 72 hours, we can activate it, and the hospitals have enough room. This is, you got to look at many factors, and but we also don't want to be alarmist. We don't want to scare people. So it is not right now time for level 1, but it is time to minimize contact and recognize and accept that it is not time to go back to life as usual.
I think you touched on this, but here's another KTRK question. Is the medical center expected to exceed hospital beds, ICU beds, within the next 5 weeks? Is that accurate?
You know, there was an initial look, where, particularly the ICU beds, if they continue with that trend, that they would have run out of space within, I think it was 4 weeks or so, in terms of their base capacity. Now, they still have surge. The concern, of course, is that the doctors have been working COVID all along. So you got to recognize also this staff has been going nonstop, and there's this limited people that are there. So right now, my conversations with the medical center is there is still enough room. We're not at a point where we're growing so fast or we're approaching the limit that we got to say shut it down. But that will depend, of course, on the rate of increase. If it starts going faster, of course, that time would be shorter. And right now, where we're seeing the biggest increase, as Dr. Peirce said, is in the general population, because first, of course, people make it to general population, then unfortunately, they get to ICU. So that's why we're catching this early. But look, let's hope we can control it, and that's the big message today, is it is in your hands, in the public's hands, to prevent us from having to go to level 1, to crisis. We hope we can still avoid that. And so we need folks to take that responsibility and do their part.
This is from last one, real quick. Telemundo, if you could answer in Spanish, of course. We have received some calls from citizens complaining about renters, homeowners, increasing their monthly payments amid this economic and health crisis. What can tenants do? Where can they get help? And what can you tell homeowners?
Una pregunta acerca de los desalojos, y hemos estado escuchando reportes de personas que se ven en riesgo de ser desalojadas. ¿Qué puede hacer el condado? Número 1, hemos abogado porque los jueces de paz se detengan en cuanto a procesar los desalojos. Ya tanto el alcalde como yo les hemos pedido que hagan eso, e invito al público a que llamen, pongan presión a estos jueces, que sean parte de la solución. Lastimosamente no tengo yo autoridad sobre ellos, entonces lo máximo que puedo hacer es pedirles, por favor, pospongan esos desalojos hasta agosto. Número 2 es apoyar a la comunidad con asistencia directa. Estamos preparando el programa que planeamos anunciar la próxima semana ya muy claramente cómo puede la gente aplicar para recibir los fondos. Van a ser entre $1,200 y $1,500 por familia, y obviamente no podemos ayudar a todos, pero vamos a ayudar a las personas más necesitadas. En cuanto a qué más puede hacer usted, visite el 211, es una línea de ayuda que le puede conectar con recursos. Esté muy pendiente al anuncio del condado en cuanto a ayuda para los individuos. También estamos preparando más ayuda para los negocios muy pequeños de 5 empleados, 10 empleados, y seguiremos luchando y abogando porque esto cambie a nivel de jueces. Pero yo no quiero dar la impresión de que tengo la autoridad de limitar los desalojos. Ya se ha hecho muy claro por parte del gobernador que esa autoridad ya no la tengo, entonces por eso estamos trabajando en esto más. Ahora, esta mañana, el representante Armando Wally y también el representante del alcalde Marvin Odom anunciaron una coalición nueva en cuanto a los desalojos, que están trabajando ellos con organizaciones sin ánimo de lucro y con tanto la ciudad como el condado para ver qué más podemos hacer. Seguiremos haciendo esa pregunta y trabajando por apoyar a la comunidad. Pero si tenemos otra crisis, va a ser peor para la economía. Y por eso necesitamos que todos pongan de su parte para que no sigan creciendo estas admisiones y no tengamos nuevamente otra crisis. Should I repeat in English?
Yeah, if you don't mind.
Yeah, so let me just, the question was about evictions and folks on the edge. And first to say, Representative Wally, who is here, and Marvin Odom, who is the recovery czar for the city of Houston, both announced this morning an effort with across the city and county with nonprofits to try and see what more can be done about evictions. As far as what we are doing at the county, we have provided the support for small businesses. We are working to disburse the $30 million for individuals. We'll have instructions on that next week, so we ask folks to stay tuned. Those dollars will go to the neediest folks. I know at the city they've already done, I believe it was $15 million in aid. Additionally, Mayor Turner and I have partnered in asking our justices of the peace to postpone evictions until August. It's become clear under the governor's order no longer do I have the authority to postpone those. And so we are asking those justices of the peace to do the right thing, to work with us and postpone those evictions so we don't have a wave of folks on the streets. Now, we'll continue to work and see what more can be done, but everybody at home can do something too about this, and that is taking that responsibility to avoid a second crisis. If we have a second crisis, a second shutdown, that's a worse hit for our economy. And so we need everybody to do their part, and we'll continue to explore everything we can do. Of course, there's always a resource for the community in 211, which can connect community members with nonprofits. Thank you so much.
Thank you.
Yeah.
Thank you very much.
Good job.